Let us talk about 5 key concepts in healthcare quality improvement, or QI. QI involves everyone in healthcare. QI is continuous and ongoing, data-driven, team-based, and focuses on improving processes and systems. We will now go over these concepts in more detail. QI involves everyone in healthcare, including healthcare professionals, patients and their families, researchers, policymakers, and payers. QI is not just the job of a few designated individuals. People closest to the daily tasks of healthcare have rich knowledge about the program or process and can use their experience to suggest ideas for improvement. Regular use of QI by everyone in healthcare promotes a culture of quality improvement and makes high-quality care a way of life. QI is continuous and ongoing. Since QI can be used to improve any process, big or small, it can integrate well into your daily work. By working to improve one or more processes that are part of your job, you contribute to making QI a way of life in your workplace. Continually improving processes translates to building a culture of quality, which in turn leads to improvements in the healthcare system. These healthcare improvements, when scaled up, lead to improvements in population health. QI is data-driven. Collecting and using data effectively improves decision-making, especially when data are used to inform improvement targets, to collect baseline information about what is happening now, and to monitor improvements over time. Data enable us to analyze processes, identify opportunities for improvement, and measure and track how we are doing. Just as we use data on our car's dashboard to drive safely and to keep our car running, we can use data in our daily job to see if what we are doing is helping us achieve our intended outcome. And remember, data do not always need to involve complex technology. A pencil and paper, or a simple computer program, is sometimes all it takes to collect and track meaningful and useful data. All improvement is change, but not all change is improvement. To make sure that any changes to processes and systems that we make actually produce improvement, we need to measure and track the intended and unintended effects of what we do. Dr. Deming was an American statistician, professor, and consultant. He is perhaps best known for the Plan, Do, Check, Act cycle, also known as the Deming cycle. He taught top business managers in Japan in the 1950s how to improve product design, quality, and sales through the application of statistical methods. Deming has several noteworthy and memorable quotes attributed to him, and one of my favorite quotes is, "In God we trust, all others bring data." QI is a team-based process. QI teams typically include a diverse group of people who are involved in the many different steps of a process. Every person is a potential QI team leader or member. Think about your own activities in healthcare. You are closest to this work and have rich knowledge about the process of program you work within. You can use your experience to suggest and try out ideas for improvement. QI focuses on improving processes and systems. It does not focus on blaming individual people for problems that are identified. Data collected as part of QI help inform us about which process need to be changed. Changes to processes, in turn, improve the entire system. So let us review what we've learned. We went over 5 key concepts in QI. QI involves everyone in healthcare. It is continuous, data-driven, collaborative, and team-based, and focuses on improving processes and systems.